Okay. Are we good? Is the mic on? How much am I getting paid for this anyway? Can't we just do this with an avatar or something? Let's delete that. Let's start with something like, thank you for having me. I wonder if anyone stayed for the whole thing. I'm a surgeon, not an influencer. But after 20 years as an orthopedic surgeon, my biggest impact may be outside the operating room. My priority, like yours, is my patients and the 800 hip and knee replacements I do each year. But I also appreciate and was shocked by the 30-second knee replacement video that reached 100,000 people in 24 hours and has now been viewed more than 10 million times. Here's what matters. According to recent data, 94% of patients research their position and medical condition online before making healthcare decisions. Over 75% of those patients say social media directly influences their provider choice. Whether you're active on social media or not, the reality is that your story is already being told. The question is, are you the one telling it? With over 1.2 million followers across platforms and still relatively new to social media, I've learned that it isn't just about building a following, it's about expanding our impact as physicians, reaching patients and providers, even industry you would otherwise never meet. In the next 15 minutes, I'm going to help you harness the power of social media effectively, ethically, and efficiently without compromising your professional integrity or spending hours glued to your phone. Because in 2024, being a great surgeon isn't just about what happens in the operating room. It's about how we share our expertise with a world that's increasingly looking to social media for medical guidance. Here's the digital health landscape today. Every second, there are over 93,000 health-related searches on Google. Every minute, there are 500 hours of medical content uploaded to YouTube. And here's the scary part. Less than 10% of that content is coming from actual medical professionals. Our patients' behaviors have fundamentally shifted. A recent study showed that 76% of patients now expect their physicians to have some form of online or social media presence, and it's becoming as essential as having a medical degree on your wall, except this credential they'll check before they ever walk into your office. Medical practices specifically that are active on social media report up to 40% higher rates of new patient acquisition compared to those without. It's an opportunity for these patients to come in better informed, with more realistic expectations, and hopefully this leads to higher patient satisfaction rates. The professional impact extends far beyond getting new patients through the door. That will happen. I already mentioned the power to connect with surgeons and industry as well, but I mean nationally and internationally. The surgeons I have met here in the US, as well as those from India, China, South Korea, and on, have made me a better surgeon. The global operating room is now in our pocket, and social media is a big part of breaking down the limitations of geography and conference schedules. But perhaps the most compelling reason to embrace social media now is this. During the pandemic, we saw health misinformation spread at an unprecedented rate. A 2022 study showed that posts from verified healthcare professionals were shared 8 times more frequently than those from non-medical sources. We have a unique opportunity, I'd argue a responsibility, to be the voice of evidence-based medicine in these spaces. Every time you share accurate medical information online, you're not just educating one patient in your office, you're potentially reaching thousands. Last month alone, surgeons on social media collectively reached over 100 million people with evidence-based content. That's more than all the orthopedic textbooks combined have reached in history. The question isn't whether social media will influence healthcare. It already has. The question is whether we as physicians will help shape that influence. Okay, so where to start? All social media is not the same. You have to respect the differences. Let's talk platforms. Maybe think about these like different surgical tools. Each has its specific purpose. You wouldn't use a bone saw when you need a scalpel. Let's start with LinkedIn. Think of it as the attending lounge of social media. With over 930 million professional users, it's where decision makers live. For physicians, it's particularly powerful for business to business connections. Hospital administrators, industry partners, and referring physicians are all actively engaged here. It's also the platform with the highest trust factor, making it an ideal starting point for those of you just dipping your toes into social media. Instagram is our growth engine. According to a recent JAAOS study, 72% of orthopedic residency programs now maintain an active Instagram account. Why? Because it's visual, immediate, and perfect for showcasing surgical techniques, patient education, and the human side of our practice. With over 2 billion monthly active users and the highest engagement rates of any platform, it's where we can make the biggest impact in patient education. Facebook might feel like old news, but here's why it matters. It remains the most used social platform by patients over 30, which, let's be honest, is most of our patient population. It's particularly effective for practice marketing because it's the only platform where patients can leave detailed reviews and recommendations. Now, YouTube, this is your long game. Unlike other platforms where content disappears in 24 hours, YouTube videos can generate traffic for years. I have educational videos from 4 years ago that still get thousands of views monthly. It's also the second largest search engine after Google, which means when patients search for what to expect after knee replacement, your video could be right there waiting for them. Finally, there's TikTok. I see the eye rolls, but hear me out. With over 1.5 billion monthly users and the fastest growing healthcare professional community, it's becoming increasingly important. 70% of TikTok users are adults, and 60% of US users utilize TikTok as a search engine. More importantly, it's where the next generation of patients and physicians are getting their health information. 49% of Gen Z uses TikTok to search for health information before Google. Here's the key. You don't need to be on all of these platforms. In fact, I'd strongly advise you to simply start with one. Master it, build your audience, then expand if it makes sense for your goals. Remember, it's better to have a strong presence on one platform than a weak presence on 5. And if you're wondering which platform to choose, ask yourself these 3 questions. Where is my target audience spending their time? What type of content am I most comfortable creating? And what are my specific goals? Patient education, practice growth. For me, it started as professional networking on LinkedIn and now has expanded to patient education. The practice growth thing, that was just an accident. What should you post? I'm going to start with something controversial. Being an excellent surgeon doesn't automatically make you an excellent content creator. Trust me, I learned this the hard way after my first few posts looked like they belonged in JBGS and not on Instagram. The reality is social media platforms have specific algorithms that determine who sees your content. These aren't evil machines trying to suppress medical education. They're simply designed to show users what they tend to engage with the most. Understanding this is crucial because the most brilliant medical content in the world won't have any impact if no one sees it. Let me share 3 types of content that consistently perform well across platforms. First, the behind-the-scenes glimpse. This isn't about showing off. It's about demystifying medicine. A 15-second clip of you marking a surgical site or explaining instruments to your team humanizes you and reduces patient anxiety. It's very common for these types of posts to generate 3 to 4 times higher engagement than purely educational content. Second is what I like to call bite-sized insights. Take one aspect of what you do and explain it simply. Instead of posting about total knee arthroplasty, talk about why you choose a specific implant or show the differences between a worn-out knee and a healthy one. Break down complex topics into digestible and interesting pieces. Third, educational content with a hook. Instead of understanding rotator cuff tears, try why throwing a baseball shouldn't hurt. Same information, but packaged in a way that makes people want to stop scrolling and learn. I've created a more detailed guide with content ideas specifically for medical professionals, which you can access through this QR code. But here's what's most important. Authenticity still matters. The goal isn't to become a medical entertainer. It's to package your expertise in a way that engages social media audiences. When you're in clinic, you naturally adjust how you explain things based on the patient in front of you. You wouldn't explain osteoarthritis to a fellow surgeon the same way you would to a patient. Social media is no different. You're still the same expert, just adapting your communication style to the platform, ultimately to the patient. Pro tip, and by that I mean things I've learned the hard way: consistency matters. The algorithm definitely favors regular posting, but, and this is crucial, quality always beats quantity. One well-crafted post per week that genuinely educates and engages is worth more than daily posts that don't resonate. Your goal isn't to go viral, it's to build trust and provide value. Understand the algorithm, but don't let it compromise your professional integrity. Create content that serves your audience while respecting the platform preferences, and growth will follow. Let's talk about social media PPE. You need to protect yourself and your practice. The same professional standards that govern us in clinic or the operating room apply to social media, with the biggest difference being any mistake or unprofessionalism online could reach millions. The professional principles don't change, just the potential impact. The American Academy of Orthopedic Surgeons published comprehensive social media guidelines in their 2022 position statement, emphasizing that our online presence should reflect the same level of professionalism we maintain in clinical practice. The Federation of State Medical Boards has similar guidance, and a summary of general guidelines is accessible through this QR code. Think of social media like the global operating room. Everything you do is being observed, recorded, and can be reviewed indefinitely. Just as you wouldn't compromise sterility to save time in surgery, don't compromise privacy standards for more engagement online. Regardless of the type of content you choose to post, there are a few non-negotiables. HIPAA compliance, written consent before sharing any patient image or story. When in doubt about sharing something, my suggestion, just don't. Before you start posting, I suggest you do at least 3 things. 1, review your institution's social media policy, if they have one. Number 2, check your malpractice insurance coverage regarding social media activity. This is a thing now. And number 3, familiarize yourself with your specialty board's guidelines. Many have published excellent resources on maintaining professionalism on social media. More detailed guidelines are available through this QR code. No amount of likes or followers is worth compromising patient privacy or professional standards. Your reputation took years to build. Protect it with every post. I use this simple decision tree before posting anything. Would I be comfortable having this displayed in my waiting room? Would I say this in front of my boss, department chair, or mom? Would I want this shown at a national conference? If the answer to any of these is no, it doesn't make it to social media. Okay, so action steps. Just start. You don't have to have a professional camera or editing equipment. Just start. Some of my highest performing content was filmed at home or walking down a hallway when I had just a few extra minutes. This video about why do you have to show up early for surgery received 7 million views. Shot on an iPhone, walking down the hall before a case. For social media, the most important tools are your expertise and willingness to share it. I've put together a starter guide with everything you need or you might want. Basic equipment, free editing apps, posting schedules, and content ideas. You can access it through this QR code, but here's what matters most. Just start. Begin with one platform, create one piece of content, share one insight that might help someone make a better decision about their health. That's all it takes to start. Last year, I performed 800 surgeries, but through social media, I was able to reach and in some cases influence some 200 million people. That's the power of social media. I'm happy to help any of you get started. My contact information is on the screen, and I've included my email in the resource guide. Don't feel like you have to figure this out alone. Let me leave you with this thought. Every day, millions of patients are going online for medical information. They're going to find something. Shouldn't they find us?